Good afternoon. Welcome to the ARC MIDAS Health Economic Subgroup. If you didn't know we had an ARC MIDAS Health Economic Subgroup, then welcome. We've got a few more people who accepted and said they were coming today. The format of the health economic subgroup is really for anyone. It's not for health economists really. It's for anyone who's interested in health economics. The subgroup does the MIDAS group in general does lots of work in lots of different subgroup areas. Health economics is just one of them, and there's a lovely website which does lots of things, which Lewis is going to tell us about just briefly in a moment. But first of all, I would say that myself and Angela Boland at Liverpool and Valerio, who's not here today because it's his daughter's first birthday, at UCLan are the leaders of this group, of this subgroup. We have talks usually once or twice a term, and there's a great website which Lewis does a lot on, and he's about to talk about. So Lewis, I might hand over to you. It's Luís Filipe, who works at Lancaster, who's a member of the MIDAS group, and he's just going to give us a brief update on some exciting new things which are on the website before we have our talk from Heather, who I'll introduce in a moment. So thank you, Luís.
Hello. Can you just let me share my screen? I think you need to make me co-host or something. Yeah.
Do I now? Crikey. You're talking to someone who uses Teams. Luís, as you well know. How do I make you co-host?
So go to participants. Go to my name. You should have probably the 3 dots or something. Or
okay. More. Make co-host. Okay.
Yeah.
There you go. Thank you.
Okay, I think that should be enough. Yes. So let me share my entire screen. Just showing you this, just one slide, is to tell you about what we have been done in health economics within the ARC Northwest Coast and what we are going to do. The first thing I want to tell you is you can, if you have your phones or whatever, you can use it to access here our website. So you can see that our website is going to have, basically, we're trying to record everything that we have done. So of course who we are, but then we can see that we have our meetings, all the meetings we have had so far. So you can see the first meeting with Sophie Wickman, Luke Mumford, Brendan Collins, the second meeting with me, the other meeting with Alex Thompson and Joe Coast. Then you also have here the content of our Simplifying Health Economics, which is basically a YouTube playlist we have within the Northwest Coast, the ARC Northwest Coast YouTube channel, where we basically do some videos where we try to simplify these technical concepts that are so important in health economics, such as opportunity cost, such as thinking at the margin, sometimes even more technical, such as regressions and so on. We try our best. We hope that it can be accessible to someone who is not an health economist. By the way, you also have the link here in the second one to that playlist precisely. Let me stop it. You can see that we have 10 videos so far. Lately, we have been doing other things, so we have not been updating this so much, but we still have some concepts that we want to put in here and that we will. Then you can see also the resources to our blogs, so not only vlogs, also the blogs. So recently we have done some vlogs on health technology assessment. It's a series with 5 vlogs, so you can also come here and check the vlogs. We have an overview. Then we have the 4 other ones about the challenges of undertaking health technology assessment, one about opportunity cost and budgetary constraints, another about political decision making and societal preferences, equity and HTA, lack of resources, and so on. And then finally, we have here just the overall ideals, what we are trying to do in terms of methodological development in this health economics part of the ARC. Now, finally, and this is very important. We have a webinar on the 4th of April, and this webinar, we are calling it Introduction to Economics and Health Economics. So in fact, it's going to be a webinar where, first we talk a little bit about what is health economics, and then the second part is really more about economic evaluation. And it has a reason. The idea is that we are kind of promoting a new project that we have, which is this RACEs, which is the rapid conversion of economic evaluations. Some of you are probably aware of the original RACEs with only one E, which is the rapid conversion of evidence synthesis done in the MIDAS group, which is usually you pick a systematic review and you summarize it, you create a commentary on that. Now, what we are doing is to adapt that concept to economic evaluations. Now, in this webinar, we are going to promote this new course we are going to create, which is going to be a 6-session course running more or less from May to September. And the idea is that the persons taking, coming to this course are going to be able to read an economic evaluation, are going to be able to interpret everything in there, are going to be able to create a commentary on that, explaining, summarizing it, explaining what are the implications for practice. And at the end, the idea is to create this commentary and try to publish it. So that is the outcome of this 6-session course. So more on that will be made available in this webinar. If you want to go to the webinar, and please go email Valerio. I think we are also going to be sharing a form eventually for people to register. But if you know you want right now, you can email Valerio and it's done. And I think that's it for now. I will give it to Bruce and to Heather.
Sorry, before you just start there, I've just put something in the chat, Luís Filipe, about whether there's an opportunity to rerun this. I think there's lots of certainly ARC member organisations that be interested in this, but one that is you're not giving them enough notice, and secondly, it's Easter holidays, so I didn't know whether it was going to be recorded or I know that's not as good, but if there was plans to run it again, that would be great.
Yeah, I think it will be recorded, and yeah, okay, that's a good suggestion. We may decide to run it again. Yeah. Also, if people don't go to this webinar, in principle, if they are in our mailing lists, they will still receive some type of information for the RACEs, and they should still be able to register in the course if they want. So it's not going to be mandatory that you need to be at the webinar.
Okay, thank you.
So I think this could be recorded and then maybe a shorter version done later, Paula, or something like that before the course starts. But we're happy to get feedback as well if you need it run again, of course, or you think there's an audience for it, because, you know, I guess we don't know what we don't know. So
I should know what's on the MIDAS website, but when people show me things, I'm always amazed at all the amount.
Well,
especially around digital, there's a big push
indeed
in our member organisations about economic value around digital intervention. So yeah, I'll speak to you outside of that. That's really helpful.
Okay,
good to know.
Thank
and
you.
there's stuff going on in the RSS, Paula, as well, we might want to talk about in terms of support across that as well, but we can talk about that separately.
Well, thanks, Bruce.
Giving Heather okay, no worries. Thanks, Suresh, that's great. Before again, we will let Heather talk, but one more very quick thing before she gives her talk, and that is I'd like to introduce Misael Anaya, who's just started it's Wednesday on Monday. So Misael is a senior research associate here at Lancaster, and he's part of the ARC MIDAS team as well. So Misael, do you want to give us a wave, Misael, if you can hear us? There's Misael, look. So anyone who's been around the office will have seen him, or there he is. So he'll be doing more stuff, and you'll be seeing him around and about the place as well, the virtual place. So that's great. Thank you very much for that. As usual, if I forget to say at the end, please get in touch if you have any ideas for the group or want any more information, or after looking at the website, you want to know any more. So everything, everything good's worth waiting for. So I'm going to now introduce Heather's portion of the talk. So Heather is professor here at Lancaster University. She leads one of the ARC themes, and I'm sure most of you who've been involved with ARC would have seen Heather do something at some stage, I'm sure. And Heather's kindly agreed to come along today and give us a talk. So Heather, I presume you're happy to introduce yourself and what your talk's about, and about, I don't know, we've got about 30-35 minutes. Do you want questions along the way, or people
yeah, you can interrupt me at any time?
Okay.
I also need to be made a co-host because I can't share my screen. Sorry.
Well, I should do that then, shouldn't I? So
so I think
I obviously know how to do it now.
Yes, as I say, participants.
There you go.
Okay,
yeah, should be able to do that now.
Now
Thank
I can
you,
see
Heather.
that. All right. So I apologize to Bucket and Kosar because I've taken some Amelia slides. You'll have seen some of this before. So you may want to go, unless you really want to hear it twice. Oh no, and I've gone to the end. Okay. Go to the beginning. Okay, can everyone see that okay?
Yes.
Yep.
Yeah. Okay. Sorry, because now I can't see anyone. I just see two versions of my presentation. So if you have any questions, just stop me at any point, because as I said, I can't see anything. I just see my presentation on two different screens. Okay. So I was just going to talk a bit about the Blackpool HDRC, which is the Health Determinants Research Collaboration, and how you can potentially be involved. Okay, so just a bit about Blackpool. This is where it is. It's in the northwest on the sea. It's actually, when you look at it, it's really small. It's 35 square meters, or square kilometers, not square meters. That would be really small. And it is very highly densely populated. So it's the seventh most densely populated place in the UK. And the most densely populated in the north of England. And it is a unitary authority that sits within Lancashire, but that and Blackburn and Darwen are both unitary authorities, but the rest are districts. And then you have Lancashire County Council. Okay. And so a bit of the history of Blackpool. So it originally was a very small fishing village, but then from really the 19th century, with the introduction of the railroad, it became a very popular tourist destination. As you can see, it was very, very busy. And by 1911, the railway station was the busiest in the world. And followed that, there was loads of building of holiday accommodations and attractions such as Blackpool Tower, the Winter Gardens. And after most of the 1960s and 70s, with the introduction of package holiday and cheap air travel to Europe, Blackpool lost favour as a holiday destination for people in the UK. They'd rather go abroad where they had more reliable sunshine. And that led to a decrease in overnight accommodation. Decrease in people staying for, their summer holidays. They'd go someplace else. And then this was kind of the start of Blackpool being synonymous with decline. So then this shows some pictures of Blackpool more recently. So in 2019, it was ranked as the most deprived town in England and Wales. And it's in the top 10 for the following measures of deprivation, income, employment, and crime. And as high rates of domestic abuse, the highest rates of domestic abuse and crimes against the person in England and Wales, and the highest rates of adult substance misuse in Lancashire, which is really 3 times the national average. And a report by Plan International UK reported that Blackpool was the worst place to grow up as a young woman, as the highest rates of children in local authority care, which is like, can't remember off the top of my head, I think it's 251 per 10,000 compared to other places where it's like in the 30s, and I think the national average is 50, and has the lowest life expectancy in England and the second lowest in the country after Blackpool, and has higher years of living with a disability. Okay, and so some of the reasons leading to this decline, we talked about the its declining popularity as a holiday spot in the UK. There's also, and then because of that, when it was a popular holiday spot, you had lots of holiday accommodation, which was turned into houses of multiple occupancy, and most of these were built at the turn of the 20th century, so they need lots of maintenance and repair, which it's challenging to do, so many of them are in a bad state. There's also been, since 2010, a decrease in funding to Blackpool. So Blackpool has had approximately 218 million cut from its budget since 2010, which is a real term cut of 25.4%. And I guess related to these HMOs, Blackpool is still one of the places where you can get rent a 1-bedroom flat for about £250. So it has a high population of people who come for a short amount of time, as it has cheap accommodation. Many people have happy childhood memories of coming to Blackpool, but that comes with its own problems, as many of the people have very high needs. It also has had huge decreases in education spending. So education spending per pupil for disadvantaged children is 14% less in real terms in 2023 compared to 2013. I guess the other nature is that Blackpool is considered a town that is only open 9 months of the year. So this has led to unemployment, unstable income, and other issues as well related to poor health. But it's not all doom and gloom. So in 2022, Blackpool received more than 20 million visitors, which, if you look at that number, is more than London receives. And that's up 1.5 million on the previous year and 12% higher than the pre-pandemic year of 2019. And approximately 40% of all people who visit Lancashire in 2021 went to Blackpool. And Stanley Park, which is a grade 2 listed park, was voted the best park in the UK twice in the last 3 years. And you can see some pictures. So this is from the Rebellion Festival, which sees international tourists come, particularly those from the Netherlands and Germany. And there's the International Firework Day and the Winter Gardens, and that hosts Strictly Come Dancing each year. And Blackpool has also received lots of investment. I don't know if anyone heard, on Friday it was announced that they received another 90 million from the Levelling Up Fund for regeneration of housing in the centre of Blackpool. They've also received, on top of that, 40 million of other levelling up investment. So some of that went 6.5 to the community sports village, the central courts relocation, which is just under 7 million, illuminations modernization, which is 4.5 million, has led to the Festival of Lights, which happens every year, and the Multiversity, which is 9 million. That hasn't started to be built, but that is supposed to create approximately 3 million jobs if it does what it says it's supposed to do. And as well, the funding which we're discussing is that NIHR HDRC, which is £5 million. So the Blackpool HDRC, what is it? So a health determinants research collaboration was what HDRC stands for, and it's a collaboration with Empowerment, the Boing Boing Foundation, which I left off the slide, Lancaster University, and Blackpool Teaching Hospital NHS Trust, and it's funded by the National Institute of Health and Care Research. The funding officially started in October 2022, so we're in year 2. So it's one of 30 HDRCs. The ones in blue, and Newcastle, which for some reason isn't in blue, were the original trench of HDRCs that have been going since 2022. And the other ones are the new ones, which had been recently announced a few months ago. And in our region, we have Cumberland and Liverpool, and I guess you could also consider Manchester. So the ones with the stars have a development year, which means they have 6 years of funding. And in the first year, they're supposed to be kind of meeting certain criteria to get the additional 5 years of funding. And before the HDRC funding application went in, some people at Lancaster did a Delphi survey to understand the barriers in Blackpool to becoming a research active council. And these were the key things identified. So the first one was lack of funding capacity for research. The second one is lack of research infrastructure. So understanding kind of, I guess, the factors that enable research, and expertise in research. And the other thing is there was an existing culture of health, higher education-led research, but that much of this research didn't feed into how the council operated. So part of this is that external organizations were not familiar with Blackpool Council structures and functions, that there's not really a research career trajectory path for people working in the council. And the idea that for any research that was being undertaken, that the council was a partner but not a leader. So it was the idea that the university led and that they more kind of were, you know, a secondary partner of that. And then as well, the burden for small stakeholders and lack of familiarity with Blackpool Council structures and processings. So limited existing culture of knowledge exchange, data sharing, which still definitely exists. Poor understanding of the value of evidence-based practice research. And research could be an additional burden for small private third sector providers that are in partnership with the council. Okay, so what is the aim of the HDRC? So basically it is to become a sustainably research active local authority, to embed a culture of evidence-based practice and co-produce research in line with local and organizational priorities. And through this, so if this is done, it is thought that this would then address wider determinants of health and reducing these health inequalities that we saw in Blackpool. And I guess thinking about where this comes from, it really comes from evidence-based medicine. So it's looking at how medicine has changed since the 1970s, and the idea that once the NHS adapted evidence-based medicine, health outcomes got a lot better because they were doing things which were shown to work. But in many cases, this is very different for a local authority because you can't really do randomized control trials. It's not saying, does this drug work or does this not? So it creates a challenging environment to achieve these outcomes. So the objectives with the HDRC are an equal partnership with the residents and communities. Particularly for Blackpool, they're very keen on having community-led researcher approach. So an asset-based approach to research capacity development. So I assume that means that using people's existing skills to improve their research ability to undertake research, strengthen council processes, so that deals with the research infrastructure, strong collaborative partnerships with key organizations, work with the 4 council departments, I don't know which ones these are, to identify priorities and to disseminate the learning, so that's the knowledge exchange element. And the 4 research priority areas are housing, the first 1,001 days of life, so that's 0 to 2 years old, education, employment and skills, and mental health, with public health as a cross-cutting theme. And so in terms of health economics, a particular area of interest is around using the data, and in particular, a large part of the budget, Blackpool's budget goes to to social care. And one of the things that they're interested in particularly is around predicting future demand for social care, both adult and child, understanding factors that lead to people to being the high cost cases. Yeah, so there's a lot to do potentially if you're interested in social care data. And they also have other data. They don't really know how to use it. So some of it is looking at data infrastructure. And then if you're interested in a specific priority area, there's also that opportunity to get engaged with that. Capacity development, so some of the stuff that Luís talked about, that, you know, health economics training, there might be some interest within that. And then exploring mechanisms for community engagement activities. So how you can get community members involved in research from the start. And that is a whistle-stop tour, sorry, I can't see anyone now at all, of HDRC. Ooh, let me stop sharing. Okay.
Thanks, Heather. What opportunities do you think? I know you're not you're the only person here to answer this question, so you may not know the answer. I'm not expecting you to be representing the HDRC here, but What opportunities would you feel for people to get more involved, or how would people get more involved?
So the opportunity is particularly around social care. I think they have a lot of data. They don't know how to use this data. There's a lot of things that they're interested in. So even some things there is a new family safeguarding model. So they're interested in evaluating that and the cost effectiveness of this approach. So kind of prevention strategies to how, so one of the things, I guess, is preventing people from going into the costly care. So there's the risk modeling aspects of it. So say, who are these people? And then predicting demand so they can kind of plan better. And then I guess it's reducing demand is the other area.
And in practical terms, how would people get in, how would they get involved?
The things are very confusing. So there is an HDRC email, but it is also that I guess it'd be a gatekeeper system. So there are people within social care who are interested. There's Bertie Goff, who's a workforce development lead. So he's very keen, but there's not a specific, So if someone's interested, I'd say the HDRC email, I'm going to put it in the chat.
That would be very useful.
Is the best one. Or you can ask me or Amelia or Ruben.
Yeah, no, it was just a response to Bruce's question. So I'm a member of there's HDRC. There's also a of multi-professionals, some academics, some people from other entities like NHS R&D Northwest that are funded by Health Education England, who coalesce quarterly to talk about sort of wicked issues and challenges. They met last week, and their impetus now is to try, and Booker, who's on the call, is also a member, is to try and get further external research funding, coalescing all them skills. But their conversation last week was around where do we get the relevant academic support from? So I think as another point of contact, input into that group would be really, really helpful, because you've got all the practical skills, deliverers, commissioners, but don't have that expertise, certainly not in health economics. But I know that their aspiration over the next 12 months is to co-produce and be investigators on an external piece of work that they apply for. And that could maybe tie in with some of the issues that Heather's raised in terms of social care.
And again, thank you, Paula. And again, in practical terms, if anyone here is interested, they would contact.
Yeah, well, certainly if they contact me.
Okay.
They've had some change in admin, so I don't want to send you an email and then it doesn't get answered. But I can certainly find out the date of the next meeting, and I can share a slide with whoever. So they've got two researchers that people probably will be familiar with, Ruben and Amelia. And Ruben had done a bit of a quick trawl of current available funding opportunities and presented to the group last week. Shared that on a PowerPoint slide as a PDF. So I'll share it with you, Bruce, and you can cascade it to the group so they can see the types of things that they're thinking about thinking of applying to external funds for, but they very much don't know what they want because they don't know what they don't know, if that makes sense. So yeah, I can certainly put people in contact with the lead for that group, and then you can get you on your mailing list.
That'd be great. Would you be happy to stick your email in the chat today?
Yeah, no worries. Yeah, no, it's fine. I'll do that now. Yeah, no worries.
Thank you. I think Fiona's next. Zoom doesn't do a 1, 2, 3 thing like Teams does. So I'm not selling Teams here, by the way. Fiona, I think you were next, so sorry if you weren't.
Thanks, Heather. Really interesting. My question's more about how connected are this group to groups that we might have more established links with, like Lancashire Care Trust, who obviously cover the health side of Blackpool. I'm thinking sort of a lot of there seemed to be a phase, this is particular to mental health, where social workers and social care and health became integrated. So some social workers are employed in the trust as part of care coordination teams and stuff. And I just wondered are these completely separate entities, or do they already overlap? Because there's some interesting questions around mental health in particular, where the social and health aren't as clearly distinct.
So that's an interesting question. And the answer is, I am not sure, because it's one of those things where it is still very siloed. So, you get put in touch with someone. So Bertie Goff is relatively new. I think he started about a year ago, and I know his brother from Newcastle because his brother works at Newcastle University. So it is kind of one of those things that but you know, he is in the children's social care unit, so he does only works within the children's social care, and that's what he was interested in. But that's not to say that there's other partnerships, but it is still very, I think, based upon personal relationships. And that is, I guess, one of the things around the research infrastructure that the HDRC is trying to achieve is how do you make it more than just who you know? How can you put these structures in place that these systems can operate if one of these people leave, and don't rely on academics having personal, you know, building those personal relationships with people in these organizations. And I don't have answers to any of those questions.
Tracy, I think you were next. I hope.
Thank you for a really nice talk, Heather. And I feel a bit like an intruder because I'm from the wrong end of the country, but I did come to Blackpool last year for the illuminations. It was very nice. My question was about really how my understanding of HDRCs. Southampton's only just got funded, so it's a very early stage, but it's meant to be working with the people in the area, and I wondered if you had any plans, or maybe I don't know who's the right person to ask to integrate that in health economics, and how you were doing that.
So I can tell you. So so the Blackpool model, they're using a community research model. So there's 20 community researchers, 10 adults and 10 young people. So ages, I think is 18 to 24 or 25, I can't remember. And that's commissioned through 2 charity organizations. So Paramount is the one who's doing adults, and this organization called Boing Boing is working with the young people. And so one of the things with capacity building around health economics is I did a health economics workshop to these people, but it was, I don't know, went super well, because a lot of it is hard to kind of get, you know, that basic to say, well, this is what it is. So, and then I tried playing some games around like market things, but I think that that is a challenge of how to get people thinking about it. So some of the stuff around resource allocation, I think people can get and understand, but then the methodology of how you actually do it and incorporate it, I think is a lot more challenging. And besides doing the seminars, which I said, it was kind of a half day, and you could tell by the end that people were falling on the floor with boredom. So I think it is challenging of how to get that to work well. Because I think some of it, starting with the games, if you do games, that works, but it's how you get some of these things, at least I don't know how to make kind of cost, you know, how to actually do it into a game.
Yeah, that's really interesting, because yeah, that's kind of, I was thinking of that now, but so yeah, no, it's interesting. Thanks.
So Tracy, are you in, just to pick your brains about yours, are you, I know it's only just started, but you know, is it starting in a similar way? Is it, you know, in terms of integration within the region and the way the research is planned? And I presume there might be different aims, of course, with yours as well.
It's quite interesting because the wider Hampshire put a bid in and that didn't get funded. So the one that got funded is literally city centre, Southampton. And I think the reason that was much more successful than the Hampshire bid was because they were much more integrated with the community groups and they could demonstrate. So I think they have got those kind of links, but it's then thinking through the steps of how you actually engage those in the research elements of it. I mean, so that's the challenge.
I was going to say, a lot of the stuff that they've tried so far does not work. I can tell you what doesn't work. So they've tried including people like in team meetings, and again, I think it's beyond what they are used to and experienced with. So some of the things I think that we've talked about, so there's people who have volunteered for these roles are passionate about a certain topic. Most of them have one thing that they're really interested in. So I would say some of that is almost trying to think about almost helping these people develop that research question and doing a small piece of research. Because I think because now we're almost 2 years in, is that they need to think about more, not everything needs to be a great academic output, because it's not going to be, but to maybe have stuff with the community researchers that it's actually really useful for them. And that is just kind of getting them on the stepping stone to say, well, to think about the questions to ask, to think about what kind of health economic analysis can we include, what will it look like, and to give them realistic goals things that they can achieve. Like I even, when I had done the training, I did Excel because I thought, I was like, oh, everyone can use Excel. And some woman was like, oh my goodness, this is overwhelming. And I thought, I was like, oh, I spent ages trying to make this really, really easy.
Oh. Yeah, no, it's quite a step back, isn't it, from where we're used to teaching and training.
And are the HDRCs linked up with the research support service at all? And so it sounds like, because I do find, you know, when you're in a certain region and there's several different initiatives going on, you know, we end up duplicating things that we do for other parts of often things funded by overall the NIHR or a similar organization. Are they, you know, it sounds like, you know, project development and working on things could be really integrated and helped by the research support service. And I do wonder if we're doing the same thing several times for different audiences where we could learn more
I think
each
you're
other
probably
as well.
right, because Southampton as well has a public health specialty, doesn't it?
I was going to say we're better placed, I think, for that to be joined up, but it's harder because now it's more national service, isn't it? So, yeah.
So ours is social care, our RSF, Research Support Service, specialty social care, isn't it? But there's still the basis of health economics and everything else in there that there always was in the RDS, of course. So sorry for anyone who's not involved. I'm trying to not use every acronym I know this afternoon. But it does appear that there must be a way we can make, even in our little corner of the methodological world, it more efficient across, even within each region, but again across the country, Tracy, as well. I bet we're doing the same thing. I'm sure the HDRCs probably will end up doing, the new ones will end up repeating the good and bad things that have been tried elsewhere anyway, maybe.
No, I totally agree. I think there's definitely need to kind of try the dots.
I think so. And also the School for Public Health Research and the ARC and the HDRCs in health economics terms all have a health economics component to them, and a group probably within them that we could probably integrate in certain ways and at least make it more effective and learn what we shouldn't be doing is as important as what we should. And I'm sure, Paula, in other areas that's probably true as well.
Yeah, I was just putting in the chat, maybe the ARC has just secured some funding. We're not clear on the detail yet around social care interns and PhDs, but you're absolutely right, Bruce. There should be a health economic element that interweaves in some of those, you know, because we're reflecting that there's a need there. So I think that it's been discussed at ARCFest. So Luís Filipe, I don't know whether you're at ARCFest. We've got one of our colleagues who's attending, maybe feedback via emails to this group about.
So I know that the one next week. Sorry, Paul, I don't mean to talk over you.
All right.
Miss AL's going.
All right,
which
cool.
Is first ever ARCFest. So if you could say hello to Miss AL, that would be great.
Don't leave.
But if you
after that, please come back.
But if there's anything you're chatting about health economics, because I don't think Luís is going, are you, next week?
No, I have another event already.
Okay, yeah.
It's going to be a busy week.
If you could say hi to Michelle, and then if there's any discussions about health economics, he can feed back to the group. That would be fantastic. Thank you. That would be great. Okay. Co's there, and I apologize 100% if I've mispronounced that. Oh, you're there? Oh, hi.
Yeah, hi. I've got a question, and I just wondered, because Heather, you talked about there was a lot of data that they have, but they don't know what to do with it. And I was kind of thinking from a university perspective, what are the opportunities then for like making better use of that data and thinking about the master students that might be doing some kind of health economic piece of research or whatever it might be, sort of better linking, or how that might work. I know people have talked about things like this, and I think Liverpool University have got, is it Exchange? I can't remember the name of it, where students are placed with organisations. So I know there's all the challenges about data sharing and all of that, but I'm just kind of wondering what the opportunities are.
That's a good question. And I think there are, because they do, so they have, some of this is like with the social care data, they have all this data, but they don't even know how to analyze it. But at least with that, I think they have some clear questions of things that they want to know, which makes it a bit easier to see, well, how you can do it, saying, well, we have this data, you know, how can we do these demand functions? So that makes sense. Some of it, I think they don't even know what kind of questions to ask with the data, which makes it much harder, because it's like, yes, you might have loads of data, but how much of it would be usable for research purposes, and what kind of questions can we even ask with it? And I think that's part of one of the things with building research capacity. It's almost getting people to know what kind of questions are feasible to ask.
And how is that moving forward? Is there a process for that?
No.
Okay.
So if anyone has any ideas of how, because there's kind of, how would you even develop training, like of how, you know, how to ask research questions? How can you kind of develop those skills where you can look at these things saying, well, this is interesting. You know, these are questions we might be able to ask from this data.
I think it would be useful for some of you to sit down with Catherine Gedling and talk about this in terms of the research support service, because I do worry they're organising things as well, which are duplicating a lot of this, and it would really help. And it's all free, and it's what they're there for. So it might be useful to do that. Sorry, Chloe, I didn't realise it was you to put your camera on. I do apologise.
It's
fine. Did you have your hand up, Fiona?
I was just wondering if there's, I mean, obviously a starting point to think about the questions to ask, or what is the data? Like what would be really helpful is just a summary of what the data is that they have. Because obviously that's going to drive the kind of questions that realistically we're going to be able to ask.
Yeah, so I guess the thing is that that's why I think they're almost overwhelmed, because they have so many things against all the services they provide. They will collect some data.
Yeah. We need like a map, don't we, with like, and what the quality of the data is. So
yeah, so one of the things, you know, they're interested in is data linkage. So thinking about you know, the housing data, some of the health data, some of the you know, social services data, education data, that they, but then it's a sort of, you know, but they one, there's no identifier, so it'd be thinking of different linking strategies of how you do that, and then sort of thing is, what are the sensible questions you can ask with that data?
Yeah.
Tracy,
have they done some kind of prioritization process? Maybe it doesn't need to be as formal as James Lind Alliance, but maybe
they have been. Well, yes, they've been trying it, but again, I think it's one of the interesting things where politics get in the way. So they've done it with councillors, but obviously the councillors have then they've tried doing it with the people, but they were so broad that they only had like only 95 people responded, and there was no consistent pattern in the data to draw any conclusions from that. And then they have been toying with the James Lind Alliance, but again, I think you almost need to know, you know, you need to have an area for that to be a sensible process. You can't just say, well, what can we do across everything that we do? And even just to do, because they have those 4 priority areas: mental health, first 1,000 days. Even within that, there's so many different things. I think it needs to be a bit more focused to actually come out with anything useful.
But do you know are they having any big days where they're inviting people along to do anything, or is there anything planned? Where
well, they've had learning days, yeah. So they had a learning day, but again, I think it's one of those things that, how do we communicate these things to people who might be interested? And so that was one of the things I was hoping to come here to say, that they're really, the social care is probably one of the most developed things. They're really keen to have people do this. So I was hoping that, you know, that would be a way to start to get these conversations moving with a wider range of people.
Paula, I think you're up next.
Yeah, I'm just wondering, you know, Bruce, you've talked about sort of coalescing NHR infrastructure, of which obviously the HDRC is one, but also don't forget Blackpool doesn't sit in a vacuum. So Heather's talked about other HDRCs who will no doubt be having this same issue, and we've got a couple in we've got 3 others in the Northwest, including Manchester. I'm just thinking about within integrated care teams, you have a place-based focus. So, you know, I absolutely get it. You know, how you know, stick your finger in the air for a research question, and we already know anecdotally and practically that even within the public health sphere, those technical skills are being lost in local government around research and being able to articulate really narrow down and focused questions. But within ICBs, you have population health teams who have, you know, to go back to you, Fiona, who have dedicated data sets that they're commissioning services on. And I've been to a couple of their workshops, a couple of their meetings, and have no health economic background. And I'm scared by the assumptions they're being made to commission services based on graphs that they're saying about impact, etc. So I'm just thinking, in addition to HDRC, there might be an ask where we can sort of bring in those key strategic leaders in population health teams who are really senior in the ICB to perhaps understand. So priority setting will be met by financial considerations. We're in a local government setting that, you know, Birmingham are going bankrupt, and we're already getting told that public services are going to be slashed, and local authorities need to work more effectively, whatever that means. Do more with less, which is a load of nonsense. So I think we need to be practical in supporting them about what is it you need an evidence based on that's going to hopefully have some type of influence in either securing more money or more people, or something that tells a story a different way, instead of councils being seen as these deficit organisations who don't know what they're doing, when in fact they do, but they need some support from their, you know, their anchor institutions that are in a place. So maybe the ICB through the population health teams would be another sort of good allies to get on board in these types of conversations around health economics.
Fee? I think you're on mute, Fee.
Just talk to myself. I was just saying, I totally agree with what Paula said, and having had a conversation with someone who's a mental health lead in the ICB, she was saying exactly the same, that they need the expertise of the academics who can, she said that we get loads of data and then we have to commission services, but we don't understand the data, we don't know what to do with the data, and there's a real need to bring in the university, which needs to build these partnerships for engagement and all the other tick box things, that actually there's a real opportunity, I think, to have that as a multi-way conversation.
I guess it's like there seems to be a theme of how do we get to know about this, and how do people get involved and hook up with each other. There appears to be lots of people who want to get involved and want to help, and it, you know, all this data is, you know, is what we want. We want to get our hands dirty with all the stuff that's going on. But I guess it's that thing of, you know, how do we get involved? Who do we contact? What happens? Are there meetings? I know we're all busy doing other stuff, but
yeah. So I guess it's maybe like getting these people from the ICBs to come and speak at these meetings, because it's kind of, I guess it's how, as I said, bring it beyond the individual people, because it's the sort of thing, it's what, you know, that to spread it out wider and to get that greater expertise of more than just one person who can't do everything.
Yeah, that sounded like a heartfelt one person who can't do everything plea there, Heather.
And maybe there's already places where these meetings are happening that we need to be sitting in, rather than trying to create another meeting infrastructure.
Yeah. Oh no, I don't.
Yeah.
I totally sympathise there without having no more meetings. But I'm just wondering that how do we find out what to go to and when and where, I suppose.
So in terms of ICB, Lancaster and South Cumbria, I know less about Cheshire and Mersey. They have a population health team meeting, and I've been to some of them. So the lead for that is Paul Hegarty. He's the population health lead for Lancaster and South Cumbria. And Andrew Bennett's who's like a senior director. He's almost like oversees all the work, but it's Paul who's the program lead. So I can certainly get you his email, or see when their next meeting is, ask them what the appetite is, because I think, again, with these things, you know, Heather started at the same as it's a name of a name, and we need to think about structures and processes for what it looks like if we've not got that name. And I think that might be something they're working through, but I can certainly have a conversation with him and see where I stopped going, to be fair, because it was frustrating. But yeah, they do meet regularly. They meet at least monthly. But so it's all what they're doing is gathering data for what will they then present as clinical priorities to the ICB. So it's things around CVD, cardio, respiratory, you know, the typical what you would expect, but based on sort of prevalence, as opposed to maybe cost of some of those interventions that are around prevention, stuff like that. But yeah, I can speak to Paul and see, is there already something there that they're doing? It might be that they've commissioned somebody, but I can certainly ask him and see, and then either get him to come here, or maybe we could think about somebody going to their group meeting and asking the question around, is there something of need that needs to be done?
I wonder if there's some way this can be part. The ARC can get more involved with organising something that brings this together. You know, because a lot of us are keen, and a lot as individuals, and we can then contact someone else we know, but it's still us contacting individuals we know and trying to pull something together. I wonder if I contact the ARC and try and get them to organise something that does bring everyone together who's interested in this at an ARC Fest or something. So not an extra, nothing extra or additional in meeting terms, but just something that's planned maybe for the next ARC Fest, and just have a session bringing people together, because you need to get everyone in the room, don't we, somehow?
Yeah.
Okay, I'll try and do that. That's great. Look, that was a really useful discussion, I think, to have. Thank you, Heather, for kicking that off. And if we can actually pull something together, and I think across HDRCs as well, Tracy, so thank you for coming. I think, you know, I think we should all be working together. You know, we're all supposed to be, all the funding's supposed to be achieving similar things, isn't it? Not replicating the same thing over and over again and not quite working, which is often what happens with these things. So maybe, okay, let's all reflect on that. It's a bit of a qualitative word for me, isn't it? Let's all reflect on that and think about it, and see where we can get to in terms of organising something. Just getting everyone in the room, I think Paul and others have suggested, might be a good thing. Thank you all very much. That was hopefully a useful ARC MIDAS Health Economic Subgroup afternoon session. And we all learned something. Thank you for Lewis for the updates. There's some great stuff happening on the website there. So thank you very much. That's fantastic. And hello again to Miss Ale. Welcome on board. And anyone who's going to the ARC Fest next week in Liverpool, might see some of you there. Otherwise, thank you very much. Get in touch if you've got any ideas for chitty chats at the next meeting. That would be great. And otherwise, we'll see you soon. Next ARC Fest is June 11th in Morecambe. Oh, well, no excuses for some of us then. We'll have to go to that one. Is it at the football club?
Yeah.
Is it? Oh, no excuse at all. Good food there as well, I've heard. Anyway, thank you all very much for coming.
Thank you.
Fantastic. And I'll see some of you soon and some of you not so soon. So thanks again.
Thanks, Bruce.
Thank you.